Good morning, ladies and gentlemen. Welcome to the Malacañang Press Conference. To start off, may we call on the Assistant Secretary for Policy and Legislative Affairs of the Presidential Communications Office, ASIC Kris Ablan.
Good morning. I am Christian Ablan. I am an Assistant Secretary of the Communications Office. Secretary Andanar and Spokesman Abella are both accompanying the President to Laos for the ASEAN Summit today, and so I will give the introduction this morning. Our resource person is known in the medical community as a humble worker. Dr. Paulyn Jean Rosell-Ubial started her career as a rural health practice volunteer in Kidapawan, North Cotabato. She joined the Department of Health as a medical specialist 1 in Cotabato City and literally rose from the ranks. She served as DOH Assistant Regional Director in Region 6, also Regional Director in Regions 9 and 11 before assuming the post of Assistant Secretary of Health in 2008 up to June 2016. In July, President Duterte appointed Dr. Ubial as Secretary of the Department of Health. Secretary Ubial has 27 years of experience in the public health sector with expertise in maternal, neonatal, and child health programs. She recently arrived fresh from her official trip in Cuba to learn about the island's popular health system, which the President hopes to replicate in his universal healthcare program in the Philippines. Ladies and gentlemen of the Malacañang Press Corps, let us all welcome Secretary Ubial.
Good morning, members of the Malacañang Press Corps. Indeed, I am honored and it is my great privilege to give you an update or a summary of our recent visit to Cuba. With me during that visit were 10 officials from the DOH, WHO, and also from the local government units. We have members from the hospital as well as public health. And we also had with us, in coming to Cuba, the members of the Philippine Embassy based in Mexico City. So it was a 2.5-day trip starting on the afternoon of August 23. And we left Cuba in the morning of August 26. We went to their various health facilities, like of course, the Ministry of Health, the Family Physician's Office. That's the most frontline facility. And the Polyclinic, which is a multidisciplinary, multifunctional outpatient clinic, and their hospitals and tertiary hospital facilities, as well as other, shall we say, support facilities, like they have a mental health unit, which is strategically located in a cluster of municipalities. They also have a maternity waiting home for high-risk pregnant women. And also the geriatric home or home for the elderly and senior citizens. So with that, we conclude that and also some of their training facilities, the health emergency training facility, as well as the College of Medicine. In conclusion of our visit, there are a number of interventions that we can adopt in the Philippines based on the Cuban model. But the central point of the efficient and effective health system in Cuba is actually the human resource complement. That Cuba has a system where they produce adequate numbers of health professionals, particularly doctors, that their human resource to population ratio is more than the ideal ratio that the World Health Organization is actually promoting. In Cuba, there is one doctor for every 1,075 persons. The WHO standard is, for public health, one doctor is to 20,000 population. In our setting, the standard is one doctor is to 33,000 population. So I have asked my staff in the human resource unit to actually compute how much will it cost the Philippines if we adopt the Cuban model in health human resource. And if it's a doctor at the front line or one doctor for every barangay, so that's 2,000 to 5,000 population, that would cost us around 57 billion additional. But that's only for the salary of the health worker. Now, if it's a midwife or a nurse that will be in the front line per barangay, that would be around 25 billion pesos. So there's a lot of other things that we observed, particularly the referral system in Cuba, that people cannot go to the hospital directly. They have to go to the primary facilities and they are referred to the hospital. There's no private sector in Cuba. So everyone has to go through the public facilities. And then there's also the idea of the Cuban government providing for all expenses, including drugs and medicines, including transportation. If a patient needs to be brought to the hospital, they have ambulance services, but the ambulance is not linked to the hospital. It is an independent unit that the doctor or community member would call so that the patient is brought to the hospital. So there are so many things that Cuba is doing because of their own for so long, and that they had to develop their own health system and their own capacities. So with that, I think the Cuban health system is actually based on a principle of prioritization. It was given about 28% of the national budget to the health sector. And their, shall we say, per capita expenditure on health is $460. The Philippine per capita expenditure on health based on the 2015 budget is $76. So I think we have a lot to learn from the Cuban model, and they say it's one of the best because the infant mortality is less than 4 per 1,000 live births. In the US, it's about 8 per 1,000. So their infant mortality rate is better in Cuba. It's less, so it's better. And the maternal mortality rate in Cuba is less than 20 per 100,000 live births. And that's about the same as the US. But of course, we know the healthcare delivery system in the US is one of the most expensive in the world. But their health indicators are similar, if not Cuban health indicators are better. So with that, I think we can, the Cuban government, particularly the Minister of Health, also indicated to me that they are willing to have capacity building and exchanges in the future, cooperation, like their doctors coming here or our doctors going there to learn from their system. So with that, I'm sure that our universal healthcare dream will benefit from the lessons that we learned in the Cuban model, and we will continue to have this cooperation and relationship with the Cuban Ministry of Health so that we can implement some of their best practices. So with that, thank you and good day.
Thank you very much, Secretary Ubial. The floor is now open for questions. Joseph Morong of GMA 7.
Hi, ma'am. Good morning po. Ma'am, you mentioned that we need at least 57 billion to approximate Cuba's healthcare system. How many doctors do we need from that based on that figure?
About 35,000 additional doctors.
Do we have that?
No, we don't.
So paano yun, ma'am?
That's why we have the model that we can have one health worker in the interim until we are able to produce enough doctors to field to the barangay level. So in the interim, we have one midwife or nurse per barangay.
Ma'am, is this something that you already proposed to the president?
We are actually in the process of calculating what is feasible. Like in the interim, maybe one midwife per 2 barangay. And then move on until in the 6-year period of the president, probably be able to address one doctor per a number of barangay. Because what we have now is that the current situation is one doctor per municipality. But in one municipality, we have about 20 to 30 barangays. So the ratio is one doctor per 30 barangay. So maybe in the 6-year term, it will be one doctor per 5 barangay.
Just one last question. Why don't we have the 35,000 doctors?
Our health system or production of human resource is unlike that of Cuba. In the Cuban model, their School of Medicine is under the Ministry of Health. So they are able to produce medical graduates that are attuned to their health agenda. For us, we have only 5 state-owned colleges of medicine, and our production is not that many. And in fact, even our board exam passers for medicine is about 30%, 30 to 40%. In Cuba, it's 98%. Because they make sure that the doctors they produce pass the board exam. But we also have to consider the quality of the healthcare professionals. But anyway, I think that's also one of the strengths of the Cuban model, that they really make use of the health professionals that they graduate.
Dexter Ganibe of DZMM.
Follow-up lang po, Secretary. Doon sa mga nabanggit nyo, kailan masisimulan yung pagbabago doon sa binabanggit nyo doon sa mga barangay na magkakaroon ng mga health workers? Effective ba next year?
Yes. No. That depends on the budget, actually. Because it will cost us to have additional human resources in the health system.
Yung budget ng Health Department for 2017, may kasama na po ba doon
Yes.
sa mga pagbabagong dagdag?
Actually, what's in the budget of the DOH is the facility. Like we had in the development plan, Philippine medium-term development plan of the DOH, that we will have one barangay health station per barangay. So that's in the pipeline. So we're about 16,000 barangay health stations, and we have 46,000 barangays. So we're short of 30,000 barangay health stations. But in 2015, we already had 3,500. And in the 2016 budget, another tranche of that much, so about 7,000. So if we want to attain the ratio as we proposed, like the Cuban model, we have to fast track the development of this infrastructure so that we will ask the local government unit to actually fund the salaries of the health workers that will staff the facilities.
Ma'am Hannah po from Sunshine. Follow-up ko lang po, sinong particular na medical staff po na ilalagay per barangay? Nurse or
In the interim, it will be a midwife or a nurse. But eventually, we're hoping that there will be a doctor. Not one per barangay, but a cluster of barangay, one doctor.
So sinabi niyo po ma'am kasi problema din natin yung napoproduce natin ng mga doctors, nurses. So paano natin i-bridge po yun? Ngayon magdadagdag tayo ng mga stations, tapos saan din natin kukunin yung mga taong ilalagay din doon?
So we're trying to look at the universe of where we are. And then we're offering scholarships, for example, for geographically isolated disadvantaged areas and indigenous peoples, for them to take up midwifery, nursing, or medicine, so that we expect them to be the ones going to these hard-to-reach areas. And then we're also looking at the state universities and colleges to actually have some sort of arrangement of mandatory deployment before they can go to other specializations or other fields of practice.
Celerina Monte of Manila Tribune. Shimbun.
Good morning, ma'am. Ma'am, you have mentioned that we are going to implement some of the best practices of Cuba. So may we know specifically what are those?
Yung number one ngang nakikita namin is the health human resource, no? And the other best practice that we saw was the mental health unit. This is an outpatient facility that actually covers several municipalities. Wala po silang, in Cuba, they don't have a mental institution. All their patients are outpatient. And it's parang delivering the services at home to the patients. And parang meron silang daycare services. If you're going on vacation, then they can take care of your mental health patient family member on 2 to 3 day period. So, hindi yung long term.
So itong sa mental health na to, are you going to establish another mental health facility or what?
So we're looking at a community-based mental health program because that's what Cuba has right now. And then tinitingnan namin if that can be another facility or that can be add-on to the existing rural health unit but actually deploy separate human resources for that.
Ma'am, on another, it's still within the DOH, yung orthopedic na privatization, would this administration push for this? Kasi I believe nag-fail yung bidding before.
Wala hong move for privatization. It's a public-private partnership. Oo.
So yung PPP na yon, it would still push through.
It's right now not being considered because we were provided the budget to upgrade the Philippine Orthopedic Center in its current location.
So at least for the next 6 years, yung Filipinos would be assured that this orthopedic center would not be privatized. Is that an
Hindi ho,
assurance?
there was no move to privatize the Philippine Orthopedic Center. The move was to upgrade it and modernize it. So meron pa rin hong balak to upgrade and modernize it.
Under PPP or basically under the government na budget?
It will depend on the government's position kasi right now, even in the cabinet meetings, we're talking about PPP. We're talking about PPP
So,
for big infrastructure projects.
so hindi pa rin dinadrop yung possibility na this would be placed under PPP?
Mhm.
Last two questions. Ted Tuvera of Tribune.
Ma'am, balik lang po tayo dun, ma'am, sa healthcare issues. Ma'am, kasi I understand sa Cuba, yung mga doctors doon, mga facilities doon ay state regulated. Ang kalaban dito, dito sa Pilipinas naman, karamihan ng mga doctors ay nasa private practice. Ma'am, do we have an effort to convince those in the private practice to engage also in public health? Yung example, yung sa mga doctor to the barrios.
Yes, yes. There's been a lot of collaboration and negotiations with the private sector physicians to actually service the rural areas. So the idea is for them to adopt a hospital or a health facility. So there is continuing effort of upgrading and capacity building. So that's the mechanism that we are looking into. Hindi yung parang lilipat sila from private to government, but to actually support the government, the health facilities.
Next, Tina Mendez of the Philippine Star.
Good morning, ma'am. Pwede pong makahingi ng update on the Davao incident, in the increase in the fatalities based on the injuries of the victims. Ano po pang indication nung mga injuries, shrapnel wounds, whatever? Updates.
Yes, it's a blast injury, no? So many of the patients are actually shrapnel injuries. And we have a total of 84 victims with 14 deaths as of today and 70 injured. So of the 70, not all of them are in the hospitals. 55 are in the hospitals and 28 are in our Southern Philippines Medical Center. That's the only DOH hospital in Davao City. And as of the report of our hospital chief, that they have adequate blood supply, they have adequate human resources, surgeons and specialists to attend to the patients in the government hospitals as well as in the private hospitals. So they have not given the number of critically ill patients, but we're hoping that the 55 that are hospitalized now will actually survive.
Any other needs po from the national government to augment yung personnel or any other needs sa Davao Hospital?
Right now, wala naman ho silang hinihingi na additional. Blood supply, drugs and medicines, human resources are adequate.
Okay, thank you very much, Secretary Ubial. May we have again ASIC Kris Ablan for further announcements.
Thank you, Secretary Ubial. Thank you. I think we have a few minutes left for a few questions from the media. Maybe we can limit it to proclamation that you've all been waiting for. Ayun na ba yung question?
Well, yeah, since you mentioned, meron na sir bang general order, executive order?
Before the president flies off to Laos this afternoon, he would have signed a proclamation prepared by the executive secretary regarding the declaration of the state of lawless violence before he leaves.
Proclamation, GO, EO?
It's a proclamation. No number yet because he hasn't signed it yet. But we anticipate the president to sign the proclamation before he flies off to Laos this afternoon.
Sir, ano po yung sinasabi ni Attorney Panelo na this has been prepared or is being prepared even before the Davao blast? Tama ba yun?
Due to the broad intelligence reports submitted to the president, received by the president of the various potential possible incidents, the president may have talked or discussed with Chief Presidential Legal Counsel Panelo regarding the drafting. But to insinuate that there was a preparation for a proclamation specifically for that's just a conspiracy theory. But since he assumed office, the president has been receiving intelligence reports, and maybe that was the source of discussion between Chief Presidential Legal Counsel Panelo and the president.
And the intel information has something to do with both drug threats and terroristic attacks.
Yes.
Okay.
Yes.
Sir, may mga panawagan po, ASEC, dun sa, kung maalala nyo yung bank account, joint bank account ni Mayor Sara and then Mayor Duterte. May mga panawagan na mag-donate or mag-deposit kahit tig sa 10 piso or 5 piso. Nakarating ba yun sa Malacañang? Or kung may update tayo kung available, kung okay ba yung account niya?
I've actually
Para dun sa nangyari sa Davao, parang tulong dun sa mga pamilya.
Yes, I've actually received a post on Facebook tagging me requesting to donate at least 5 pesos. I have raised the matter with the Office of the Executive Secretary to confirm such event. But those things might be the work of private individuals. But again, I've raised it with the Executive Secretary, with the Office of the Executive Secretary.
Okay, sir. Kasi hindi naman natin mapigilan yung mga gustong mag-donate talaga kasi pwede ka namang mag-deposit ng amount doon sa bank account kasi naging na-publicize na yung account number.
Yes.
Any message from the palace?
No official message regarding the fundraising on social media. I will confirm with the Office of the Executive Secretary if there is such a drive, but personally, I would proceed with caution.
Rosell-Ubial of UNTV.
Good morning po, sir. May we know the reason kung bakit po downgraded to blue alert status yung military sa NCR given the fact na mas ini-intensify po natin yung visibility ng police and military? Hindi po kasi nila sinabi kung ano po yung dahilan.
That is a call of the National Police to downgrade the alert level in NCR. So we are not privy to the information also gathered by the PNP. So that's the judgment call po of the PNP. But again, we have to stay alert po. Probably one last question.
Doris Bigornia of ABS-CBN.
So you said call ng police yung pagda-downgrade ng alert level. This morning there were several bomb threats in the university belt. So you think itataas nila ulit yun?
That's possible, ma'am. I cannot speak for the PNP. They have their own protocol regarding that. But it depends.
But
on the
would the
situation.
palace recommend?
The assigned caretaker of the palace is Executive Secretary Medaldea, and I'm sure General De La Rosa and the ES are in talks regarding these instances. Like I said, there is a there will be a proclamation to be issued today regarding the declaration of a state of lawless violence. So they would be coordinating with each other.
Follow-up lang. You said earlier that Panelo and the President could have discussed this earlier, yung pag-declare. In that possible discussion, talaga bang inisip o plinano na nationwide at hindi lang Mindanao-wide yung declaration na yun?
I'm not privy to the discussion between the Chief Presidential Legal Counsel. I can only say that there have been intelligence reports that certain cities are targeted by terrorists prior to the explosion in Davao, and the President may have consulted the Chief Presidential Legal Counsel, being his legal counsel, regarding the matter.
Sir, Benji Liwanag of DZBB.
Yes.
Sir, tanong ko lang, bakit tumatagal yung paglagda ni Pangulong Duterte dito sa executive order or memorandum circular or yung ilalabas ng lawless violence? Until now ba, are they studying it before he leaves the country or paano po?
Actually, the proclamation is already drafted. I was informed that it just needs the signature of the president. So there is no more study being made. The proclamation has been drafted, and we're just awaiting for the signature of the president. The crafting of the proclamation took some time in order to be clear as possible, so that there would be no rumor mongering as to what the intention of the proclamation is.
Thank you very much.
Sir,
Thank
just
you
one
very
last
much.
question. Is the palace aware of the bomb threats in schools in around the Malacañang area?
Sorry, I'm not privy to the information about that. We will get back to you regarding those possible threats.
Okay, sir. Thank you.
Thank you very much, ASIC Kris Ablan. We'd also like to thank our guest for today, Secretary Jane Paulyn-Ubial, together with ASIC Eric Tayag.
Thank you
Thank
very
you very much. That concludes our Malacañang Press Briefing.